ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾನು ಬೆನೆಡಿಕ್ಟ ಡಿಸೋಜಾ. ಆರೋಗ್ಯ ಸ್ಪಂದನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಸ್ವಾಗತ. ಇಂದು ನಾವು ಫಿಟಲ್ ಮೆಡಿಸಿನ್ ಬಗ್ಗೆ ಮಾತನಾಡಲು ಬಂದಿದ್ದೇವೆ. ಅದರ ಬಗ್ಗೆ ಹೆಚ್ಚಿನ ಮಾಹಿತಿಯನ್ನು ನೀಡಲು ನಮ್ಮೊಂದಿಗಿದ್ದಾರೆ ಡಾಕ್ಟರ್ ಸೌಮ್ಯ ಬಿ ಜಿ, ಕನ್ಸಲ್ಟೆಂಟ್ ಫಿಟಲ್ ಮೆಡಿಸಿನ್, ನಂಜಪ್ಪ ಹಾಸ್ಪಿಟಲ್, ಕುವೆಂಪು ರೋಡ್, ಶಿವಮೊಗ್ಗ. ಇವರು MBBS ಕಿಮ್ಸ್ ಹುಬ್ಳಿ, MS OBGY BJMC ಪುಣೆ, ಮೆಡಿಸ್ಕ್ಯಾನ್ ಚೆನ್ನೈನಲ್ಲಿ ಇವರು ಭ್ರೂಣಶಾಸ್ತ್ರದ ಪರಿಣಿತಿಯನ್ನು ಹೊಂದಿದ್ದಾರೆ.
ನಮಸ್ಕಾರ. ನಮಸ್ತೆ.
ಮಹಿಳೆಯರು ಭ್ರೂಣದ ಬಗ್ಗೆ ತಿಳಿದುಕೊಳ್ಳಲು ಪ್ರತ್ಯೇಕ ವಿಭಾಗವೇ ಬಂದಿದೆ. ಭ್ರೂಣದ ಆರೋಗ್ಯ ಅಥವಾ ಅನಾರೋಗ್ಯವನ್ನು ಮೂಲದಲ್ಲೇ ತಿಳಿದುಕೊಂಡು ಅದರ ಆರೈಕೆಯನ್ನು ಕೂಡ ನಾವು ಮಾಡಬಹುದಾಗಿದೆ. ಈ ಫಿಟಲ್ ಮೆಡಿಸಿನ್ ಏನಿದೆ ಅದು ಈಗ ನಮ್ಮ ನಂಜಪ್ಪ ಹಾಸ್ಪಿಟಲಲ್ಲೂ ಕೂಡ ಲಭ್ಯವಿದೆ. ಹಾಗಾದರೆ ಭ್ರೂಣಶಾಸ್ತ್ರ ಅಂದರೆ ಏನು ಮೇಡಮ್?
ಸೊ ಫಿಟಲ್ ಮೆಡಿಸಿನ್ ಅಥವಾ ಭ್ರೂಣಶಾಸ್ತ್ರ ವಿಭಾಗ ಅಂದರೆ ಇಟ್ ಈಸ್ ಅ ಬ್ರಾಂಚ್ ಆಫ್ ಮೆಡಿಸಿನ್ that deals with unborn child. While the obstetrician will take care of the pregnant lady, we fetal medicine specialist will take care of unborn child. The journey of a newborn starts from few mass of cells and emerges into fully functional human being. We as fetal medicine consultants will observe this very closely at timely interval. We also offer detailed timely antenatal scans and also blood test for the down screening. So one most important thing is during any of these scans, if the fetus is found to be structurally abnormal or if there is any suspicion that fetus is having genetic or chromosomal abnormality, we counsel the couple in detail. We'll explain the couple what is the structural abnormality, what is the cause for it, what is the etiology of it, and how severe is the condition, how frequently we should monitor the baby. And we also discuss with the couple the prognosis of the baby and the treatment options available. We tell them if the risk of recurrence of the same condition in subsequent pregnancies, and if necessary, we provide them prenatal diagnosis.
ಸಾಮಾನ್ಯವಾಗಿ ಗರ್ಭಿಣಿಯರಲ್ಲಿ ಈ ಕನ್ಫ್ಯೂಷನ್ ಇದ್ದೇ ಇರುತ್ತೆ. ಏನಂದರೆ ಗರ್ಭಾವಸ್ಥೆಯಲ್ಲಿ ಎಷ್ಟು ಸರ್ತಿ ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸ್ಬೇಕು, ಯಾವ್ಯಾವ ಟೈಮಲ್ಲಿ ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸ್ಬೇಕಂತ. ಇದ್ರ ಬಗ್ಗೆ ಮಾಹಿತಿ ಹೇಳ್ತೀರಾ?
So during pregnancy, you will be referred to a fetal medicine consultant at various gestational age. The first scan after your urine pregnancy test becomes positive, you will be referred for early pregnancy scan. In this scan, we'll confirm the pregnancy. We'll check whether the pregnancy is intrauterine or extrauterine. We'll check for the number of fetuses, whether it is single, twins or triplets or multiple order gestation. And we'll measure the length of the fetus. And we also check for fetal viability, that is fetal cardiac activity. And the second important scan will be the NT scan. That is a very important scan not to be missed by any pregnant lady, and it is usually done between 11 to 13 weeks of gestation. And the third important scan is the anomaly scan, which is usually done during 5th month of gestational age. And along with NT scan during 3rd month, we also offer down screening blood test to the pregnant ladies. And at the time of anomaly scan, if the lady has missed down screening test during 3rd month, we also offer quadruple blood screening. And the last scan around will be growth scan, that is usually done 2 months after the anomaly scan at around 28 to 30 weeks of gestation. And during this scan, we'll see the amount of liquor around the baby, we'll see the presentation, and we'll see the growth of the baby. If the baby is growing good, if the blood flow is good, we do scan after 4 weeks. If the baby is not growing good, if the blood flow is not correct, then we might need to frequent scans for that baby. So in total, during the whole pregnancy, if the lady is a low risk pregnancy, we do almost 5 to 6 times we do scans. But in case of high risk pregnancies, the number of scans will be more.
ನೀವು ಹೇಳಿದ ಸ್ಕ್ಯಾನ್ಗಳಲ್ಲಿ NT ಸ್ಕ್ಯಾನ್ ಕೂಡ ಒಂದು. ಹಾಗಾದರೆ NT ಸ್ಕ್ಯಾನ್ ಅಂದರೆ ಏನು, ಅದರ ಇಂಪಾರ್ಟೆನ್ಸ್ ಏನು ಮೇಡಮ್?
So NT scan is a very important scan that should not be missed by any pregnant lady. So now NT scan ಅಥವಾ nuchal translucency scan ಅಂತಲೂ ಕರಿತೀವಿ. It is usually done between 11 to 14 weeks of gestation. So ನಾನು ಮುಂಚೆನೇ ಹೇಳಿದಾಗೆ this is a very important scan and should not be missed because the baby is fully formed by this time, and major structural abnormalities, if present, can be detected at this early stage only. Nuchal translucency is a fluid behind the neck of the fetus, and this fluid will be increased if the baby has any chromosomal or genetic abnormalities. And along with nuchal translucency, we also see nasal bone, the blood flow to the liver, blood flow to the heart. These are called soft markers. So any of these abnormalities in these markers will tell the fetus is having increased risk of chromosomal abnormalities. And one other important thing is, during NT scan we also see blood flow to the uterus by checking blood flow in the uterine vessels. Any alteration in the blood flow in the uterine artery will tell the mother is at risk of developing hypertension in the later part of gestation. And also it will tell the risk of having IUGR babies in the later part of gestation. And this will help the treating obstetrician to start medication like tablet echosprin that will reduce the risk of developing hypertension in the later part of gestation. And the last important thing is, along during NT scan we also see the cervical length. We measure the length of the cervix. So that will, if the length of the cervix is small, that will tell the risk of having preterm labor, preterm deliveries in the later part of gestation, and that will help the obstetrician to give progesterone medication so we can prevent the preterm deliveries. So there are many advantages of NT scan. So, all pregnant ladies should be get done an NT scan.
ಈ ಟಾರ್ಗೆಟ್ ಸ್ಕ್ಯಾನ್ ಅಂದರೆ ಏನು ಮೇಡಮ್? ಇದು ಎಷ್ಟನೇ ತಿಂಗಳಲ್ಲಿ ಮಾಡಿಸ್ಬೇಕು? ಇದರ ಇಂಪಾರ್ಟೆನ್ಸ್ ಏನು?
ಸೊ ಅನೋಮಲಿ ಸ್ಕ್ಯಾನ್ ಅಂತ ಕರಿತೀವಿ, ಅಥವಾ ಟಾರ್ಗೆಟ್ ಸ್ಕ್ಯಾನ್, that is also called as TIFA scan, that is also called as level 2 scan anta. So this is also very important scan. It is usually done at 5th month of gestational age, between 20 to 22 weeks of gestation. So in this scan we do a thorough detailed systematic examination of the baby from head to toe. So during this scan almost 90% of the anomalies can be detected if present. And also during anomaly scan, if the lady has missed her NT scan, we also see certain soft markers which are the markers for chromosomal abnormalities. And if the lady has missed her down screening in the first trimester, we also offer quadruple screening along with the anomaly scan.
ಸುಮಾರು ನವಜಾತ ಮಕ್ಕಳಲ್ಲಿ ಹುಟ್ಟಬೇಕಾದ್ರೇ ಹೃದಯ ಸಂಬಂಧಿ ಕಾಯಿಲೆ ಇರ್ತದೆ ಅನ್ನೋದು ಕೇಳಿಸ್ಕೊಂಡೇ ತುಂಬ ದುಃಖ ತರುವಂಥ ವಿಷಯ. ಅದನ್ನು ಭ್ರೂಣದಲ್ಲಿ ಇರಬೇಕಾದ್ರೇ ಅದನ್ನು ಪತ್ತೆ ಹಚ್ಬೋದಾ ಮೇಡಮ್?
ಓಕೆ, ಇದನ್ನು ನಾವು ಫೀಟಲ್ ಎಕೋಕಾರ್ಡಿಯೋಗ್ರಫಿ ಅಂತ ಕರಿತೀವಿ. ಸೊ ಫೀಟಲ್ ಎಕೋಕಾರ್ಡಿಯೋಗ್ರಫಿ, ಓಕೆ, ಇದನ್ನು ನಾವು ಫೀಟಲ್ ಎಕೋಕಾರ್ಡಿಯೋಗ್ರಫಿ ಅಂತ ಕರಿತೀವಿ. ಸೊ ಫೀಟಲ್ ಎಕೋಕಾರ್ಡಿಯೋಗ್ರಫಿಯಲ್ಲಿ ನಾವು ಡೀಟೇಲ್ ಸಿಸ್ಟಮ್ಯಾಟಿಕ್ ಆಗಿ ಮಗುವಿನ ಹಾರ್ಟನ್ನು ಪರಿಶೀಲನೆ ಮಾಡ್ತೀವಿ. ಆ್ಯಂಡ್ ದಿಸ್ ಈಸ್ ಯೂಶುವಲಿ ಡನ್ ಅಲಾಂಗ್ ವಿತ್ ದ ಅನೋಮಲಿ ಸ್ಕ್ಯಾನ್, and it is usually done between 20 to 24 weeks of gestation. And fetal echocardiography-ಯನ್ನು ಯೂಶುವಲಿ ನಾವು ಎಲ್ಲರಿಗೂ ಹಾಗೆ ಸಜೆಸ್ಟ್ ಮಾಡೋದಿಲ್ಲ, but if the mother is having certain high risk factors, then we have to do fetal echocardiography. So for example, if the mother is having diabetes, uncontrolled sugars, we have to do fetal echocardiography. If the mother has previous baby, that baby is having any congenital heart disease, so we have to do fetal echocardiography in the present pregnancy. And if there is any family history of congenital heart disease, then also we have to do fetal cardiac scan in the present pregnancy. And one more important thing is, if the mother is conceived because of IVF conception, and then also fetal echocardiography is must. And if there is a twin gestation, especially in case of monochorionic twins, we have to do fetal echocardiography. And sometimes if the mother is obese, her BMI is high, then also there is increased chance of baby having congenital heart disease. Another important thing is, if the mother gives history of any infection or teratogen exposure in the early part of gestation, we have to do fetal echocardiography. And the last is, if the mother is having any autoimmune diseases like SLE and all, we have to advise her fetal echocardiography. So anomaly scan ಆದಮೇಲೆ usually after 2 months of anomaly scan, we do growth scan, that is around 28 to 30 weeks of gestation. So during this growth scan, we see the amount of liquor, we see the presentation, and we see the growth of the baby and blood flow to the baby. So if the baby is growing good and blood flow to the baby is normal, then we have to do scan only after 1 month, that is 4 weeks. But if the baby is not growing properly and blood flow to the baby is not good, there is less blood is going to the fetus, then we have to do more frequent scans. Sometimes if the growth is too much less and the blood flow is not proper, sometimes we may have to do scans so frequently, like once in a week, sometimes maybe every alternate days also.
ಇಲ್ಲಿಯವರೆಗೆ ನಮಗೆಲ್ಲ ಫಿಟಲ್ ಮೆಡಿಸಿನ್ ಬಗ್ಗೆ ಮಾಹಿತಿ ಕೊಟ್ಟಂತಹ ನಮ್ಮ ಡಾಕ್ಟರ್ ಸೌಮ್ಯ ಮೇಡಮ್ ರವರಿಗೆ ಹೃತ್ಪೂರ್ವಕ ವಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸ್ತೇನೆ. ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್.